I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We have any introductions or guests or attendees?
So I will just let folks introduce themselves. Maggie, if you'd start, and we'll just go that way to the back.
Yep. My name is Maggie Craig, and I am Taylor's intern, a public health intern here at Pot County. You might have seen me at the August or July board meeting, but yeah, I'll be presenting later. So, yeah.
All right.
Rebecca Richardson, Pot County Health Department of Health Education, previous intern.
Aaron Small, PIO.
All right. Go ahead and pull up the meeting. We're going to approve the September's minutes. Everybody had adequate time to review this for accuracy. Any concerns, questions? If not, I'd entertain a motion to approve the minutes.
I move that we approve the minutes from September. I'll second that.
All right, we'll do a roll call vote. We'll go start with Zach.
Yes.
Kim,
Yes.
Susan,
Yes.
and Michael Chaffee's yes. All right, old business, Swope Health Services Family Health Care Clinic contract update. Who's going to do that for us?
I will. So it's in my report, more or less, and I'm sure Dustin has some things in his report that allude to it, but Swope is here. They have been here since the beginning of the month. They've been here on Wednesday and Thursday. Right now, they still just have the one nurse practitioner, right?
Yep.
So they are trying to make some hires, but they are here. You may have seen some signage on the front door. It has the hours and stuff. They put a little bit of signage in the waiting room. Still kind of working things out. I think one of the big things, and we kind of talked about this, but Cerner wanted north of $60,000
To migrate?
to migrate. And it was going to be done no later than June of next year, is what it sounded like. And really, we only have releases for about 100 of those. So it was really going to be cost prohibitive. Dustin and his team went through all the ones that we have. They're complete file. Dustin and I actually went through to make sure they'd have everything that they could possibly want. All the PDFs of all the documents, all the records. There's some stuff they may not import, but they'll have everything that they need. And if nothing else, they'll be able to reference the flash drive. That costs time, everything costs. I guarantee it didn't cost anywhere near $60,000. And it was sent last Friday, right?
Yep, I handed it to them directly, so that way they make sure that they have they're good to go.
Great.
So we're still working on their key cards. Their staff uses 2 different key cards. One not compatible with our stuff at all. The other I was able to get programmed. So they'll be able to just have their one, it's called a PACE card. I have no idea what that means, but that's their terminology for it. But they'll be able to just have their normal badge. And when their staff changes over, we'll be able to disconnect them out of the system. So we'll have good accountability there. Justin, do you have anything else you want to talk about there? I kind of say it in my report, you have just the old family healthcare report in my report, but in the future, we'll be getting numbers from them on, it's going to be pretty basic, but I think that's really what we want. How many people are they seeing and that type of thing.
Which I do have those right now, but since they are starting out about 6 to 8 patients per day. So they're still working on growing that. They are taking walk-ins and it is going smoother than I thought it would. Like we're able to get their patients, have them come over for immunizations when they need it. And then we're able to we say someone needs like an actual physical exam, they're coming in for like a sexual health assessment. It's like, no, you need to be seen by a provider. Just working them in over there has been pretty seamless. So it's going pretty well. I know they're all very excited to get here. I think Andrew said the nurse practitioner is like their for sure staff they had. They're still working on trying to solidify a reception, customer service representative, as well as their 2 medical assistants. So they're kind of just rotating on them right now.
So the 6 to 8,
Mhm.
how's that compared to what we were doing towards the end?
I'd have to get back to you on that one, but I'd say pretty comparable.
Well, that's what I was thinking. So right out of the gate, kind of hitting the ground running is a pretty good deal. So we'll see. We will continue to provide updates on that.
As long as, the goal here was to not have a lapse or loss of services for the citizens of Black County. And we'll continue to monitor their progress and performance. HVAC update?
So we still don't have a contractor proposal request. And I say we still don't. We could have. I actually asked for them to hold off on it. They'd only had 1 bid back from Hales. They said TempCon's estimator was out till the 21st. At this point, as you know, there's not a humidity crisis. It's actually really dry. So I thought the board, and I told Dr. Kingsley this when we talked last week. I told him, I kind of just made the executive decision. I'd like the board to know we were getting the best deal, or at least know that we were getting a deal that had a competitor that was in the ballpark instead of, so hopefully no one minds that I did that, but it does look like the price will probably be about the same, but they're most likely not going to have to run new electrical. But between the thermostats and running that wiring, I think the big thing is we're not going to cause the big disruption to staff. Originally they were talking about having to have the building for like 2 days and us being out of the office and stuff. None of that's going to have to happen.
I had a conversation with the engineer.
Mhm.
Because through one of my buildings, he happened to be hired to be a consultant there as well, and we got to chat about this stuff. He has identified a substantive amount of cost savings and below what we have approved because it was transformers or electrical equipment to go in was going to be in the neighborhood of, correct me if I'm wrong, about $11,000 that they don't have to do anymore. They're going to use existing wiring and a few add-ons. So it's not going to be as much as we approved in the $40,000 range.
Well, between the thermostats and stuff, I think it's going to be right around that number, but it's going to be, we'll have to see. But I kind of understood. So at least 6 of them have to get new thermostats. But I wanted humidistats on every thermostat so we know throughout the building.
Yeah.
What the humidity is.
So I was just sharing with everybody that I think there may be some cost savings associated with that because they made some assumptions on their original bid that they now don't have to get some of that equipment. So hopefully we'll see what it is.
Yeah, well,
All right, so we move to reports. Director's report.
so I think I've already talked about the family health care. One thing I didn't mention that I probably should mention is that Swope is having an open house and ribbon cutting and would like everyone here. Aaron, I don't know, did they want anyone from the board to speak?
Not that I'm aware of. They have not said anything about that.
Can you find
But
out?
I will follow up just to inquire, to get a percent.
I asked, Dr. Kingsley if he would speak, if they do want a speaker. Dr. Chape,
I'm out of the country.
Okay, so you'll be there. You'll just fly in on SpaceX and jump in.
You'll have to run that by my wife who approves all expenses.
I'm too scared to do that, so we'll just.
She's not that ominous.
But I did ask Dr. Kingsley if they do want someone, think it'd be good for him or one of the other board members to speak.
I do too. That'd be great. And they're all fully qualified if Kingsley's not available, or if you guys, if one of you has a passion for it, jump in.
We'll make it
will
work. Yeah, we'll figure it out.
I have a pre-planned trip that,
You had told me and I just
okay.
got
don't worry about
confused
it.
on which day it was.
Well, it's hard to fly from a cruise ship and then right back. So I just, yeah.
Economically, for sure.
Yeah,
That's not a thing.
You can, it's usually emergent.
right. Oh yeah, I don't want to do one of those. I mean, I can join a meeting from there, but it's,
Yeah, I
I'm not gonna
think
make it
they
perfect.
just want someone, but
all right.
we'll say a few words and we've talked about it, but being able to, and Dr. Chauffe, you kind of said it earlier, being able to provide these services to the citizens of Platte County, but give it to the people who are geared up to do this kind of work.
Provide those services in the most cost-effective fashion with the tax dollars that are given to
Right.
us to mentor.
And hopefully even expand on the services too. So, as far as the budget, we are 75% through the year. Oh, one more thing before I move on to the budget. The water leak, the storefront that we are putting on, I think at the last meeting I'd said they had just been out to measure. The stuff is ordered, it just isn't here yet. I think it'll be another month or so before it gets installed, but we picked Jansen, who was the lowest bidder. Pretty confident in my conversations with them, and Dan, I think you are too.
Yeah, they repaired this glass, some other glass in the building.
But budget overview, we're 75% through the year. We have gotten 86.4% of our revenue, and we are at about 67.4% of our expenditures. We are in October. It's hard to believe we're in October already, but some of the things that the finance committee will be working on beyond the investment policy and some of the things we talked about going outside of our banking to do investments, we'll be getting into the budget process. And so that'll be major parts of our next two meetings for the finance committee. Can you go ahead and scroll down? As far as where we are with our total holdings and cash anyway, we are about $300,000, $298,143 above where we were last year. So if you all recall the reserve policy, at the end of November, we will be looking at balances. And in your packet in the report, it says kind of what the reserve accounts are. I think it's 40 something. It's not very much. It's going to get a pretty big infusion come the beginning of the year. But we will be making inroads on getting those to be real reserve accounts. I'm pretty excited about having that stability if something were to happen. That's my report, if there's any questions.
Zach, you good? No questions? Okay,
No questions.
just want to make sure you had a chance to chime in. And I know that you guys would. You guys are okay to move on?
Yes.
All right,
yes.
Deputy Director's report.
The big items that I'd like to report this month are we had a little bit of staff turnover, a long time. Environmental health specialist Kyle Schumann resigned, and we have since hired a new replacement for Kyle, who's also named Kyle.
Oh, my goodness.
Kyle Bledsoe. I believe he's a Platte County native, a lot of Bledsoes in Platte County. But he's very customer service oriented, and I think he's going to work out well. And then we also hired, and she just accepted, I believe either yesterday or today, Rachel Simpson to be an environmental health specialist. She'll be starting November 4th. And we are currently in the interview process for a health educator. And hopefully in the next couple of weeks, we'll make a decision on that. We also, one thing I'd like to report is that we have a doctoral student in the public health program at the University of Kansas that has reached out to us and asked if she could do a project for us. So we're working with her to come up with a curriculum for new employees, a professional development curriculum for new hires, and actually I think for us old hires too. It'd be good to have a curriculum, just things you kind of need to know as a public health specialist. So that's really all I have. If anybody has any questions, I'm happy to answer those.
Any questions, Zach? You good? Okay, shake your head. I can see you don't have to turn your mic on. You guys are good? Okay.
Yeah, we're good.
Let's move on to clinic manager, Dustin.
Yeah, so the biggest thing was trying to get our full family healthcare clinic ready for SWOPE. So as Andrew discussed, we went through step by step trying to create a document that that way the nursing staff would be able to follow it and know how to properly identify each patient record, like how to label it, name it, all that stuff, abbreviations. And we created that same table. So that way when we give the document to SWOPE, they can read that and they know, all right, so here's why we're naming it this way. Here's how we're dating it this specific way. Just that way it will go in order, flow better, and they can pull up all patient records based on the time of their visit. So we went through and we got all those records, and then we finished up last week and took it up to their IT department, and they're working on getting that. We're still getting some requests in, so we're able now, since they're here, we're just printing it off real quick and just running over to their clinic and helping them as needed. We're also working, finishing up our back to school immunizations. We usually do a lot of big TV offsite visits for a lot of the schools. So we did, I think, 4 different visits between 2 different schools, trying to get them their two-step TB testing. And then we're working on some more clinics offsite for flu and COVID this season. So we have a nursing home here the first week of November, and the Platte County Board of Services will be attending here at the end of the month. And then we're in talks with a business just right down the airport that has about 250 employees. We're kind of interested in that, so that'll keep us pretty busy.
On the subject of flu clinics, in the region, there's a not-for-profit Ian's Rainbow Flu Foundation. And the director of that I've known since 2007. I think they're looking to try to partner with people too. So if you have any need for extra staff, they may have extra vaccines. I happen to personally know who the vaccine provider is.
I think it's CVS Pharmacy, because I've been out there to their.
We used to procure them for them.
Yeah.
But they're a good organization. If you're needing, they reached out and says, "Hey, do you know anybody else we could partner with to do more flu clinics?" And I mentioned that I will bring it up at a board meeting, so it's above board and transparent.
Could you get me or Dustin that contact info?
Give it to you right after the meeting.
And we'll reach out just for no other reason, just to touch base.
Yeah, they usually do a walk at some of their clinics, and my staff and my clinics always volunteered at no charge to administer the vaccines for them. So it was kind of a community partnership that we were working with them on. So I'm only bringing it up not as a board member. I bring it up as a citizen of Platte County who was asked to let the health department know that there's another entity that has not had as big a turnout as they have had in previous years, and there might be it might be worth seeing if they and the health department and anybody else can help each other out.
Yeah, I think we've been talking about it. We are getting less demand than we have in previous years. Part of the thing is all these different places are offering it. If you have insurance, you're getting points off or cents off gas, you're getting some kind of incentive. You know, so a lot of people that maybe would have come to us or them in the past, I think are getting 10 cents off gas or whatever the thing is. And so a strategy just to talk might be a really worthwhile thing, Dr. Shelby, I think. So
yeah, I'll definitely reach out to them. I think I still have her old contact. Is it Julie?
Yes.
Yes, yeah. So yeah, I have her old email. So
Julie Boys.
Yep. So yeah, they're really great. It was really fun going there. Probably one of my favorite things was there was an 86-year-old woman who came up in her walker dressed as Patrick Mahomes with the wig and everything.
They have a lot of fun. She has a great operation, and so.
Yeah.
But
I was really impressed with it. Like what she's done for promoting flu, nothing short of.
And the
amazing.
backstory.
Yeah.
Yeah.
Yeah, if you're familiar with the backstory, I highly recommend reading into it. So.
Yeah, I've been volunteering with her ever since, 07.
But yeah, that's pretty much the gist of my report. Does anyone have any questions?
I have one thing to add to your report.
Okay.
Dan did a great job of talking about his new staff, but I believe you have a new staff member too, right?
Oh yes, we have new, Jenna is a new registered dietitian. We hired her here, a few weeks ago. She's enjoying it so far. We're in the, and speaking of turnover, we're in the process now of hiring a new nurse. Julie Calvert retired after a number of years here, so she'll be very missed. But she did say she'd try to come around for any flu clinics we do and help with that when possible, so we haven't seen the last of her.
So a lot of times we've had difficulty finding a registered dietitian. And so it was actually, we had an unexpected resignation, and then, I mean, within 6 weeks, we had someone in the position.
Yeah, right, maybe less than that. Like she's a very recent grad, but she has her master's levels and she seems like a really, she did her capstone all up in a WIC in the health department, so she's very, very familiar with all of this and how we kind of do business. So we think she could be a really good fit here and seems to be doing well.
Good to hear. Any other questions for Dustin? If none, we'll move on to accreditation QI. I guess that's Taylor.
Hello, all right, so trucking along with accreditation things right now, we're still kind of in the middle of the community health assessment. We've been really pushing that community survey, and thank you guys for pushing that out as well. Rebecca and I did a facilitation training earlier in September, and that really helped us with the community forums. So we have our last community forum is this coming Saturday, and then the survey is going to be open through Sunday this week. So we're finishing up on that. I think we've gotten 1,100 responses so far. So we're pretty excited about that. And that's in addition to the city, which is doing a representative sample. So we're going to combine 2 surveys. But we should have close to 2,000 responses with that. So that's going really well. I guess another big thing that's going to be coming up is the strategic planning process. So that'll be at the beginning of next year, probably starting in January 2024. And that will be all the employees in the health department. We'll bring in you guys as board members and looking at different things. And our thought is to bring in a facilitator to come in and facilitate a retreat and some of those conversations. So we'll be sending out an RFP for that. Ideally next week. And so that's the big thing. And then I've had Maggie, who's been working on lots of great projects. She's going to be talking a little bit about the salary study a little bit later on. And then the gap analysis, we also are going to present on that in a little bit.
All right.
Any questions?
Any questions for Taylor? We'll move on. Subcommittee Chair Finance, Susan.
Yes, the Finance Committee met on Tuesday, October 8th. And their board member was a little slow and got a call and ran right over. And Maggie Craig presented the employee compensation report that we will receive. She'll present it here as well. And what our recommendations were for that will be coming up. We also have, today was the last day to get the request for proposals. And I'm wondering if that
That is what that
packet
is.
is for the financial advising and investment services that we're looking into. So do we need to open those up, and then we'll probably review those in the finance committee is what we're kind of
Right.
wanting to do first, but we'll open them
Either
up
of you
here.
can open it,
Okay,
and we can do it now.
okay.
Would you like to wield the opener?
Again,
It's heavy.
it is heavy.
And just so you know, we only got one.
Oh, okay.
Okay.
It looked like we maybe, was there interest in several?
I got multiple calls. Dan got multiple questions about it, but
Interesting.
the calls I got were from banks. And they just don't do exactly this type of work for governmental entities.
Okay.
It is kind of what MOSA who is the one, sorry,
Is this Mosa?
it is.
I just couldn't tell from the PFM asset management.
For the record, let's go ahead and acknowledge that we have opened the bid and we are going to,
Send it back to finance committee for their
For their
recommendation. I
Our
think
review.
would be the best.
and I don't think we have to take any votes for that, so.
No.
This will go through finance committee and then it'll come to us with a recommendation.
Okay,
Actually, you may have to vote to send it to committee.
All right, I'd entertain a motion to send that to finance committee.
I move that we send the RFP to finance committee for review
I'll second
And
that.
recommendation.
and recommendation.
Sorry.
Any further discussion on this, action item? Hearing none, I'll move to roll call vote. Let's go with Zach.
Yes.
Susan,
Yes,
Kim,
Yes,
Michael, yes. Moving that to finance committee for review and recommendations passes. What else do you have, Susan?
I think that was about it. Our next meeting will be November 12th.
And she left out that the reason she was late was I accidentally canceled the appointment on the calendar. So thanks for not throwing me under the bus.
Oh, we got a candy bar out of that. He owes
Yeah.
it.
It was all good.
Now
It's
we know
good
the
to live 5 minutes away.
That's true, right? Okay. Any questions for Susan? Anybody at all? Doesn't have to be a board member. Okay. Let's move to financial report.
Anything to add, Cindy?
No, the only thing, just to add, I guess, to the common theme here, I also had a resignation this past month, so I'm all interviewing for an administrative clerk.
Great. Good luck. It's challenging to hire these days. Okay. Shall we move to review and approval of bills? Have all board members had a chance to review those? Any questions, concerns? All right, I'd entertain a motion to pay the bills.
I'll second that motion.
All right,
Were you making?
I'll make the motion
Oh,
to that we
Okay, I
approve, pay the
apologize.
bills. Susan seconds. Any further discussion? None. Roll call vote. Zach,
Yes.
Susan,
Yes,
Kim,
yes.
Michael's yes. All right, fee resolution amendment.
We did have 2 this month, well, they're a combination, but we reset all of the STI testing to $0 after the board meeting last month. So there's no charge on it now for the fee that didn't reset. And then we added updated COVID and have their new pricing, and that's at $148.
What was it before?
I don't remember.
More, less?
It's less. I think it was maybe 170-ish. Yes.
Just to let you know, I was made aware there are some urgent cares in other places that now no longer offer COVID testing because they felt it wasn't necessary. But I'm not suggesting that this health department embrace that because I think it's an option that should be provided. But just to let you know that some of the health systems are starting to move away from that because it's becoming a pretty big cost center when they're doing COVID tests on 16-year-olds that don't seem to have a lot of outcome issues. And the tests are, I don't know what your guys' costs are, but I think they're selling the combo tests, flu, A, B, and COVID. I think wholesale cost of those is about $14. So
Can those still be obtained for free from the government?
I don't know.
They just sent out a new thing.
I thought that was the case.
I just ordered some and got them this week.
Right.
And Dustin, do we have them that we're distributing yet?
Yes, we do have.
So
a free
we're
testing
giving out free tests at the front.
That's wonderful. Mine was more informational than trying to sway any opinion or sentiment. Just letting folks know that I'm observing that in the healthcare community by entities, other entities.
I went to out of state meeting and they asked that we test before we come get on the plane and each day. So I asked Dustin if we had any tests, then he lied to me and said we didn't, so I had to go buy them myself. So if Dustin gives you information, you might want to verify with someone honest like Taylor or Dan.
Dustin, you need to wear black shirts because they don't show tire tracks when you're thrown under the bus.
No, it's funny because we did run out for a bit because the state is having their funding's not what it used to be, so they're not able to give out as much as they were previously. And I didn't know the shipment had come in. So when they received, our front desk staff knows what the box is and know that people love them, so they went ahead and put them out. So I get in the next day, I'm like, oh hey, you still need these? Like, already paid for them, already got them.
There you go. Anything else? All right, let's move to new business. Foundational Public Health Services Assessment and Gap Analysis.
Okay, so I think most of you know that. 1 second. Okay. Hopefully, Zach, you can see that.
Zach, can you see it pretty
I've
good?
got it. I've got it here from the packet you guys emailed. So thank you.
But when Dr. Kingsley and I spoke last week, he actually had some questions about last month's request for the 2 positions and the Foundational Public Health Services gap analysis. And he thought it'd be a good thing for me to come back to the board and just kind of go through that. So one of the things he had asked me was where that came from and where that originated from. Was that something that was just dreamt up by Dan Lubert or Andrew Warland, or where did it come from? And it actually, while it's not exactly part of accreditation, it actually came from the Public Health Accreditation Board. The Public Health Accreditation Board is not a government entity. It is a 501c3, and they administer the National Public Health Accreditation. And basically, and it says the vision, and I think this is all in your packet, so I won't read it word for word, but essentially stuff that we've all agreed to, which is, a high-performing governmental public health system is very important, and that's what we've been trying to provide to the citizens of Platte County. The foundational capabilities, which we've talked about, are an important part of delivering those services. Their mission, kind of just in line with that, and I'll just skip through that. They are governed by a board of directors, and they're from across the country. They are, I think, a conversation we were having before the meeting started with Dr. Chaffee was that, public health really should not be political. Leave those political chains at the door when you enter. And I think what you'll see, like from even the board of directors here, they're on both sides of the aisle and from across the country. I do want to point out Dr. Dart, who's at the middle bottom. He actually spoke here at our ribbon cutting. He's the one from the Tulsa County Health Department. He is also the person that hired me for my first public health management job.
It's his fault.
We'll have to talk to him.
So there's, in your packet, there's this link. So this is actually like a video that goes through the entire thing. I believe it's like an hour long. We'll sit here and watch it. No, we're not going to watch it, but it is very good if you really want to get into the nuts and bolts. But basically what it does is there's a foundational public health model at the national level. The Missouri model is very much similar. In fact, to be able to compare apples to apples, that almost has to be identical. Visually, it does look different, but through the public health infrastructure grant funding, the state health department decided, in accordance with the FAB recommendation, that states should do this across their state to see how all the individual health departments compare to each other. That's what they've chosen to do. They've actually contracted with the University of Missouri. So when we were filling out this assessment, we were filling out stuff was all analyzed by the University of Missouri. We have, in public health in Missouri, we've always done some sort of capacity assessment. It was a little bit different, but this new version replaces that. So here's the two models. The one on the left, hopefully, which is the wheel, is the Missouri model, and the one on the right is the national model. But if you look at the text, it's actually almost exactly the same. Why gap analysis matters. We're very fortunate in Platte County because of the tax levy and the taxpayers, the citizens of Platte County investing in public health. We don't have to work on $7 a person, but the state of Missouri, if you just look at state contribution to public health, is $7 a person. Yes.
Just if you are able, flesh that out a little bit more, because is that $7 per person funded through the budget of the state
Yes.
that doesn't take into account tax levies locally?
Right.
Okay.
This is just state money.
Legislative support.
Yeah. So just at the state level, if you look across the country, and we are actually 51st in the nation for state public health funding. And why 51st? There's only 50 states. That's what Dan would tell me, but it's because they include DC. So we're dead last in public
And the
health.
smaller communities, it's really
So
hard on them when they don't have a tax levy.
Where Taylor and I once worked together, they don't have a tax levy. And so for a county of 108,000 people, it was 13 staff members to do all of the things. We are about 3.5 times that size. I mean, at least probably around 3 times that size. And we still have areas where we can improve. It's, very little public health was being done for $7 a person.
I'm curious also, because we're going to have an opportunity to share this with the president of the Senate. And I want to make sure that the data is worth saying it's comparable. If I was in somebody else's shoes, would ask the question, or I'll just ask the question. I would want to make sure that, does Missouri have an inordinately large number of tax levy counties or health departments compared to Nevada? Because if Nevada has a lot less than we do who have their own tax levy, it might make sense why they have to fund it more. But I didn't know if that is an apples to apples comparison, or if anybody knows that data.
It's mixed. Okay. It's a pretty good, it's not exactly the same kind of apples. Jonathan's versus, that's the one I know. But yeah, versus Red Delicious.
Right.
So it's pretty close, but it's not exact. But it's a pretty accurate picture to say.
Good enough to ask them to take a look at this, why
Yes.
Missouri has the lowest amount of state budget support for public health of any other state in the country.
Right.
How many counties in Missouri have a tax levy? Do you know?
All but 2 of the board run. Well, no, it's 2.
2.
Period. Out of the 115, it's 2. Cass County, and then I believe it's Franklin.
They're the only 2 that don't.
Right.
Okay.
You see why that might impact the fact that we are not saying that, yes, it's the lowest amount from the state budget, but the citizens are taxed through another vehicle that gets the money into that. I wonder if that data could be analyzed to make sure the comparisons were similar.
We can, I mean,
Well,
Is Franklin South? Where's?
St. Louis area.
It seems to me this one nurse that we saw at the conference was not from either Franklin or
Um,
Cass.
I didn't prepare that part of the presentation
Okay.
tonight, so
I
I'm
think
relying
it's
on memory,
Okay.
and my
I think it might
memory
be more.
might be wrong. So I guess we can have, if you'd like us to bring that back next month, we could.
I just was curious about the information before I started to share that with people, because if we have all but 2 counties, and for example, the next closest is Nevada, and they have only 2 counties that have a tax levy, that I would look at what the total contribution of the tax levies and the state are to public health, and see if that gives a little bit better perspective. So if all the Missouri tax levies were added in, I don't think we would be the lowest in the country, because the citizens of the state are getting taxed, some local at county level, some, at state level. But I wonder if an adjustment to that could be made for total dollars, including local tax levies going into it. Because if I'm going to speak with politicians, say, we're the lowest funded, I don't want to have egg on my face when you have to look at the overall analysis, see where that makes sense. You don't want to cite statistics because, was it Mark Twain said, there's lies, damn lies, and what's worse than that, statisticals. So,
Hang on just one second, if you'll bear with me.
it might be something that we want to see if we can get some rough data on for the meeting on the 23rd. But I don't have access to be able to get to that data, but I'd be happy to come in and work with somebody who could point how to get it, and I'd be happy to do the work myself too.
It would be very interesting too.
But am I thinking
No,
clearly?
yeah,
on
I
this?
agree.
Okay.
Yeah.
I don't know if Tiffany might have that data.
I think she should. I think every county has to submit a financial report, and how much they collect in local tax revenue is one of the things they ask for.
Part of the problem is they haven't done it.
Okay.
So this is information I have carried
From 2018.
at different, as I have been at different health departments for a while. But if you combine everything, so here's the total local revenues, total revenue, all sources.
So at the bottom of your column on the far right is the average of all of those. That should give us a rough number of how much is being contributed per capita overall. And if it's $7, then we're spending the same amount on public health as Nevada. But they're just the next lowest, so we'd be, again, up to 49th. So I don't know if that column goes all the way down and you can get a average of those.
So
Just the far right column, because if it's per person or per capita, yeah, probably. I mean, does that make sense? What I'm trying to infer here, because it's not necessarily the most statistically accurate, but if it's average per capita of all the counties that do contribute, and we add another $7 to that, so we can add it and add those up, we can, if you guys don't mind, does anybody mind if we go down this very hopefully shallow rabbit hole?
well, so the total local revenues here doesn't, just because it's not zero, doesn't mean they have a tax levy. It actually means there's fees and other things that they collect money on. And so that's why Cass is showing 663,199.
Okay.
Is because they do bring in some money by providing services, get billing insurance for immunizations and different things. So that's what they're counting as local revenue. But it doesn't, so this isn't, but like if you look at Franklin at 240, 325, and then Warren it's hard to say. Some of these populations are like 33,000 people.
Thank
So
you. Well, this has answered my question for how we can proceed with our meeting coming up with the President of the Senate. That maybe perhaps we should let her and her staff work on this, and we could point out that budgetarily through the legislature, we are the lowest in the state. But we would suggest having somebody from their office evaluate the tax levies per capita to public health and add that in and make comparisons and see if that data can be compared to other folks, because I'm guessing that gap is just on what state legislatures are doing. But if local health departments are have a tax levy, I think it's important to bring that into the equation.
right,
Otherwise, we'll be just crying poor me, but I mean, the citizens are contributing money through tax one way or the other. And it's nice to know where we stand, especially for the legislature to understand if we are at a deficit, and going forward, they may need to consider bringing us up more towards the median.
I think some of those counties that don't have a tax levy, where the health department reports directly to the county commission can contribute from the general fund
Okay,
to the health department. So even without a tax levy.
okay. That's why I'm cautious to take that number and start, sharing it too much for purposes of.
It's a gray area.
Well, so, if you suggest that the legislature needs to put more funding in there, let's make sure the statistical evaluation is as accurate as you can get it. And I've already pointed out how that needs to be looked at, but I don't think our staff should, I'm not asking as a board member that the staff here do that. I think if the staff knows the information is there, we can pass it on to the folks at the state to do that analysis.
and like this is the most recent data and I've requested it since, but the state, this is the last time they did it and gave it out to people. So it's 6 years old.
Yeah.
So things have changed.
Yeah.
But Platte 6 years ago in 2018 were roughly in the top third. So we were, if you combine all the sources, we were at 60-34 per person. And the highest in the state was at 227. But there's some reasons for that. It's very small county, don't know all the details. There may be some reason, but that puts that as an outlier. There may be some local tax for something, who knows?
I do know of the counties that do have a tax levy. Platte County is, it may not be the very lowest tax rate, but it's very close to the lowest in the state of Missouri. Which, we benefit from being an affluent county and, having a good portion of our population is in Kansas City, Missouri. So,
And being one of the fastest growing counties over the last decade. All right,
yeah, our real estate keeps going up.
all right.
And I suppose, just real quick, before we move off of this,
All right.
it does look like there are actually quite a few with the zero tax rate. There's some variance because like St. Louis City, I think they just don't have a dedicated public health tax or tax health levy, but they have others types of taxes to make up for it. But it does look like there's about a dozen
That
have
may not
no tax
tax
levy,
levy. Okay.
at least as of 2008.
I was just curious to know. All right. Anything else on your report there?
Yeah, sorry.
No problem.
Get back to
I like to move meetings along.
So basically the goal of the gap analysis and the reason the state's doing it is to try to get estimates of what it would take to do all the foundational public health services across the state. We know Platte County is pretty good. We know other health departments are not nearly as good. Because they just don't have the resources. That there's quite a few health departments that have 3 people working there. To have all the expertise that you need to run a health department, that's not probably very feasible. And so looking at how to share some of that might be some real discussions we'll need to have statewide. But the whole reason this is being done is to give insights about how the resources are being allocated, to identify those gaps, go to the legislature that's the whole reason this is being done, is what is the case to take this back to the state legislature and say, we really want to, if we're concerned about the health of all Missourians, this is what we're proposing. Increasing visibility. And again, it's kind of, some places are doing it great. Some places are doing it not quite as good. And some places just don't have the resources to do it well at all. Last month, we talked about what the calculator was for us. It ended up 19. It actually has been reduced in a month by 14 because we subtracted 5. But the main reason for that is the calculations did not include that we share a jurisdiction. So Clay and Jackson also had a similar adjustment because a large part of our jurisdiction we share with Kansas City.
Mhm.
So for food inspections, for instance, Kansas City is the number, they're the primary and we're secondary. And it's kind of the same, well, not kind of, it is the same for infectious disease too. So if you live in Kansas City, Missouri proper, you actually don't get your disease investigation done by us. You get it done by Kansas City. Same if you live in Kansas City, but in Jackson, or Kansas City, but in Clay. So that's why it was reduced. But that number was from that national model. And as we kind of discussed last month, we don't intend on blindly following it, but we've had for some time known that the 2 positions that we asked for have been needed. And we felt like this was good enough justification, at least to get us started. And then as we go through the budget process and go through accreditation, we'll look at other positions and we'll bring those back to the board.
Okay.
Does that make sense?
Does.
And here's just kind of
But we're not going to create and fill positions just based upon data that is
No.
not necessarily applicable to our current circumstance setting.
Absolutely. So everything that we have asked for, there was data we knew internally that we were dying.
Yeah. Okay.
Or that's what Dan says.
But we are, in the director's opinion and the staff's, we are not woefully understaffed for the needs of the citizens of Platte County.
No.
Good, done.
Particularly now with the addition of those 2 positions.
Okay, but as we're going through accreditation, they made a suggestion that we look at that and compare it to their data. Their data suggested we needed X more positions.
Take it with a grain of salt.
Very well. But it is not an assessment of our staffing here that is necessarily accurate.
That'd be correct.
Thank you.
It also took the numbers from 2023, and so we have made changes since that. And then also they plan to do it the next 2 years as well, and to spit out those numbers again. And I mean, they did make it clear that like, they're not saying you have to do this. I think that the thought is more, we could take these numbers, go to the legislature, offer more funding to local health departments. It's not saying you need to immediately hire for these. They did clarify that this is just, you need to take into account like the community and what the needs are at the local level. Like,
But it's not a major hurdle to us getting the accreditation.
no.
Thank you.
And next up is Meg.
Salary study?
Salary
Yeah, I
study.
guess kind of a segue into that is we first want to make our current employees happy and have them stay here for a long time. So they're using this as a time.
No hard questions for her. That's what she really meant. Be nice, what she say.
And we'd like Maggie not to go back to school, just stay and work here.
Sweden.
It's really cold and dark most of the year. I'm on the phone with relatives from there every Sunday at 10 a.m.
True, yeah.
We have a big family video chat from around the world.
Okay,
They don't like it in the winter there.
I bet not.
Yeah, it's.
I don't like it in the winter here. So I
Yeah.
thought I would like it.
Okay, well, again, my name is Maggie and I'm gonna run you through the salary study updates for this past year, 2024. So a little bit about myself first. Clearly you know a little bit now, but I'm originally from St. Louis, Missouri. I graduated with my bachelor's in biomedical engineering in 2022 from Purdue University. And then I pretty much went straight into my master's in public health. After working in urgent care for like 6 months, but right into the master's program. And that ended up to be in Lund University in Sweden. And how I got to Sweden is like kind of a long story, but the gist is that I studied abroad in Denmark in my undergrad. So Europe was kind of on the radar. Also, they gave me a scholarship and Sweden is just cool. So yeah, let's see. And then I am getting my internship for my master's program. And I got set up through the Missouri Pathways program, which is run through the Department of Health and Senior Services in Missouri. And they fund interns in health fields. So they connected me with Platt, started in about mid-July, and I'm actually leaving a week from today. So getting pretty close. They gave me a lot of flexibility in what I was able to do for my internship. So I wanted to do something that was actually impactful and helpful for the health department. So that's why I'm doing the salary study. Oh yeah, also, Dan and Andrew and Taylor and Rebecca thought it was essential that I tell you that I'm a triplet. So that's me in the middle, and then my brother's over on the left, Charlie, and my sister's over on the right, Grace. And to answer the most common questions, no, we are not identical. I also can't speak to them telepathically. Wish I could. And my mom is doing great. So yeah. So yeah, among other things, I was asked to follow up on the 2023 salary study, see where we align after the change that we made last year. Shout out to Rebecca and team for the great work on that last year. We did a follow-up employee satisfaction survey this year. Pay continues to remain an area of concern. And we want to make sure that we can retain our current staff, leaving for reasons of retirement, obviously. And a salary study is a good way to make sure that we're staying competitive with our compensation. Retention is generally better at the higher scales for 11 plus, and Dan will talk about the salary scales a little bit later. And then in 2023, our staff not leaving for retirement generally left for advancement or better pay or both. And that continues to be pretty consistent year to year. Additionally, recruitment and retention are not just a concern for this health department, it's a problem nationwide. Too many people are leaving and not enough people are coming in. So we want to make sure that our compensation is competitive for sustainable recruitment and retention.
So Tiffany Bear, who you all know, she was at our meeting a while back. We were meeting with her and she said, in Missouri, if you looked at the administrators over the past 5 years, approximately 50% have been left their position and new people are in it. And so that's just a huge loss of institutional knowledge and experience.
I would attribute that to a lot of what has happened in public health over the past
Yes.
3 to 4 years.
I mean, that's exactly
I
why.
mean, there's been a lot of
But it is pretty
attention to
stressful.
it.
Dan and I will be on meetings and we're like, they're asking kind of rookie questions sometimes. And it's because half of them are rookies. I mean,
There you
that's
go.
why you get the question. Like, it just is a lot different.
Yeah.
Sorry, Maggie.
No worries. Yeah, and going off of that, one of our foundational public health services model capacities in Missouri is the ability to recruit and retain a competent public health workforce. And I've heard this board talk about before wanting to have not just a competent public health workforce, but the best in Missouri. So in order to do that, you can't ignore compensation. So just a reminder, last year we decided to do this salary study internally as opposed to externally. A big reason for that is that it is expensive to contract out a salary study. And you had a free intern last year, you have a free intern this year. So that both want to do something impactful for the health department. So you might as well use them. Also, public health is a unique field in that every department's kind of different to be able to adapt to their community needs and the changing legislation, which is great, but that makes it kind of hard to compare the different positions across the department. So you need someone that's pretty familiar with public health. So Rebecca did a lot of research last year on how we were going to conduct this study and which positions and counties to compare. So we're using the same methodology as last year, just a couple little tweaks. Most of the county health departments were chosen because of their potential for competition with Platte County. And for the most part, that meant similar populations, similar cost of living, or just physical proximity to Platte County. So a lot of them are in the Kansas City metro area. And then we decided to choose base pay as our comparison because that's kind of the easiest way to compare apples to apples, just where people are at when they're first starting with no experience. Yes. Okay.
Keep going.
Yep. So when deciding how to summarize our base pay of our other departments, we really have like two options. We have the mean, which is the average, calculated by adding all of the numbers in the data set and then dividing by the number of values in that set. It is a little bit more sensitive to outliers. So if you have, for example, an epidemiologist that's getting paid way more in one county, it's going to skew the data up a little bit more. And then the median is just the middle value of the data set. It's a little bit less sensitive to outliers. So that's ultimately what we chose to go with there. We focused on entry and mid-level positions as these seem to have the most consistency across departments in terms of job function. We have the same positions as last year. We just added our public health disease investigator position to this study. Our health departments we chose were the same as last year, except we did get Jackson and Johnson County, Kansas, into our salary study this year. We wanted them last year, but Jackson elected not to participate last year. But this year they wanted to be a part of it, so we got their data. And then Johnson County, we just couldn't get a hold of last year, but we did this year.
So Jackson was a little interesting in that they wanted to be part of it because they called and asked me for our info. And so I think they realized if they're going to ask us for it and use our study from last year, they probably ought to participate this year. So that worked out well.
Thank you for being so helpful.
Exactly.
Finally.
Yeah, they were nicer to me this year than they were to me last year, I think. Yes. So before getting into this year's results, I wanted to touch on something that we discussed or that was discussed last year during Rebecca's presentation. And this is the cost of living differences between the different counties. So I went ahead and did just kind of a bare bones analysis of the counties that were in this study, just to kind of see where we were at. So I used the MIT Living Wage Calculator, and that's the Massachusetts Institute of Technology. And they have a calculator that calculates the required annual income to cover essentials. And this source seemed to be pretty reliable from my research, and also had their most recent data was from February of 2024 for all of the counties that we had, so that's why I went with that source. So they have the required annual income to cover essentials. They report this for a few different household makeups. We used the household of 2 working adults with no children, just because that was kind of in the middle, but it did not, for the purposes of this analysis, did not make a huge difference in the cost of living analysis. So I organized them based on highest required annual income at the top to the lowest at the bottom. And then I calculated the percent difference to Platte. So as you can see, there is a bit of a spread, but on average, it costs 6.67% more to live in Platte County than it does in the counties that we compared in this study. I think it's also important to note that Platte County also has the highest median income in Missouri. So that is also something to keep in mind as we go forward. And like I said, the type of household that we chose didn't make a huge difference. And what I mean by that is that bottom number, the 6.67%, changed less than 0.75 percentage point for each of the household incomes. So as you can see, there's some pretty significant differences in cost of living. And I wanted to just briefly explain, especially for those that are outside of the Kansas City metro area, while we still chose to include those in our study. So Cole County, which is kind of the Jefferson City area, has a similar population size to us, but a significantly lower cost of living than Platte County. Despite this, at least last year, they did have a higher median base pay in most of their positions compared to us. So despite having that lower cost of living, they were outperforming us in terms of base pay. Boone County has Mizzou, and therefore a lot of new grads, particularly master's students, that we want to appeal to. So we want to make sure that we are justifying the move to a higher cost of living county, as opposed to them just going across the street and working at the health department there. Similarly, Greene County has Missouri State, so similar situation there. And then Johnson County, Kansas, is the closest to Platte's cost of living, and they're only about a 0.5 percentage point higher cost of living than us, according to this source. So I think this gives us some important context to keep in the back of our heads as we consider compensation adjustments. We're not suggesting anything with this number this year, but this might warrant some more detailed and maybe some other counties and stuff, some more research for our next round. So this year we collected updated salary information for all of our health departments. Let me just quickly go through this table because it's a lot to look at. So on the far left, we have our position title at Platte County, and then we collected the information for all of the other health departments for their best fitting position. We have the Platte County Health Department pay scale. And then we have Platte County median base pay for each position. Then we have each of our health departments, their base pay for each position. We have the mean base pay, the median base pay, which both of those are calculated excluding Platte's numbers. And then we have the median minus Platte, which you could essentially look at as kind of the difference to get to the median base pay for Platte. And then this median percent difference is kind of just a different way of looking at that number. This table's a little bit easier to see what's going on. So while we are still averaging slightly lower salaries for health departments, we're not paying lower than the median in all cases. There are a few positions that you can see are still pretty significantly under that median, and that is our community health educator position, our emergency response position, public health disease investigator position, and our epidemiologist. So as a reminder, this is where our numbers were last year. So our base pay was significantly below the median in all of our positions with an average of 14% lower. So compared to the 2023 salary study, we are making some significant improvements, and now we're just kind of at the tweaking stage to kind of get where we need to be, I think. So yep.
Where is it you think we need to be? Or is that later?
That's later.
Sorry,
Yeah.
somebody put a muzzle on me.
Yep. So we also asked while we were in the data collection stage, how other health departments are making their pay increase decisions, just to see where they were at. Most of them are kind of about where we are, so they're very like budget dependent. For example, Cole County Health Department has already received approval for a 3% cost of living adjustment in 2025. A lot of them are also merit or performance based, or a combination of that. The city of Kansas City does 3.5% increases for all employees that meet expectations every year. And that, I think, is inclusive of like a cost of living adjustment. So they don't do an additional cost of living adjustment, to my understanding. And then St. Charles County reported that they do periodic compensation studies and review their positions every 3 years to make sure that they're in the right spot with everyone else. So yeah, pretty similar to us for the most part, I would say. So in summary, for my part, while improvements have been made from the 2023 cycle, we still at least have some work to do for several positions. Our community health educator, our emergency response planner, our epidemiologist, and our public health disease investigator. Additionally, like I said, we might want to keep in the back of our mind potentially that compensation does not currently reflect the higher cost of living in Platte County compared to the counties that we studied for this study. So the health department might wish to consider adjusting at least some pay scale to remain competitive, and Dan's going to talk about that next. But before we get into Dan's recommendation, the finance committee's recommendation, do we have any questions about the data part?
I have a question. Sorry it took me so long to get here, guys. Good presentation. Question for you though is, what is the difference in cost of living between Platte County and Clay County?
County and Clay County. So it looks like Clay County is about 3% lower compared to us.
Jeff, can you see the slide?
No, but I guess that 3% seems like a huge difference between 5 Mile Drive.
Yeah. So this was just based on the, I don't know if you were here for this part. The source that I used was the MIT Living Wage Calculator. And this is just the required annual income that they predict for each county based on, I think they have childcare, food, transportation. So I could look into a little bit more for you where those differences lie.
While you're on this, just to help Jeff, since he can't see the slides, if you go to the slide that shows the actual dollar differential, can you go to that? And I think I can give him a comment that's going to assist him in this, and I think it's probably going to be in your presentation, or might be the where it showed how far behind we are. I think there was only one county or one position that was $8,000, but most of the rest of them were about anywhere between $1,000 and $3,000. Just to put it in context for everyone, a $1 an hour paid change is 2,880 because you have 80 hours in a year. So I looked really quickly, and you can see how my crazy brain works. It's either a $1 or $2 for these positions to bring us up to meet that. Because if, for example, the epidemiologist we're underpaying them by 3,500 if to be at the median. Is that an appropriate statement of your data there?
Yes.
So a $1 to $2 an hour raise brings us up. So just to put it in the context of dollars per hour for everyone's benefit, when you think about it, and you see if we're $4,000 difference from someone else, that's $1 to $2 an hour. So I just try to share that for contextual basis. Jeff, did that help?
A little bit.
Close.
So to me though, I understand. I went through the talk last year, so I kind of get the gist of how the numbers were crunched and everything. But I think I kind of alluded to it last year, and I'll say it again this year. Is to me, it's nice to know what the median is across the state and all that stuff, but really it's your local competition that really matters. So to me, I see Clay County as probably equivalent, as close to equivalence as we could get with Platte County. And so to me, I use those numbers as the numbers that in my mind that I'm thinking. So if 3%, yeah.
She actually went through that and presented the data of the methodology for the selection of the comparison committees, and that there was a good statistical energy placed in trying to make sure that it's similar to, as close to the context of what we're doing as well. I just was letting you know, because you couldn't see the slides. I didn't know when you joined either.
Yeah,
Well, we
so,
also
so like I was saying last year, and I'll say it again this year though. So like take St. Louis County, I think they're one of the highest paid counties on pay scale for everything, but I'm not quite sure that their results are the same as our results. And so money in and of itself doesn't make you a better public health department. It's really who you hire, how well they're trained, and how well you guys get along together, and the work that you get done, all that kind of stuff. I know Clay County does a really good job, just like we do. So that's why in my mind, I see Clay County as really who we should be comparing ourselves to. And that's kind of a compliment for them, as well as almost a compliment for us as well. So that's how I see it. And the 3% cost of living, I don't know. I mean, I go back and forth between the two counties and buy stuff and do it. 3% seems like a huge difference. So, but maybe I'm wrong. But to me, that's who I see as our equivalency. And so I try to look at what their numbers are to kind of decide where our numbers should be, if that makes sense.
Yeah, that's very, very fair, Dr. Kingsley. I think the biggest difference in Clay and Platte is in housing costs.
Yes.
And I can say I purchased a home 8 years ago, and the same developer was developing the same house plan in Clay County. And my house, just because it's in Platte County, was 10% higher at that time in cost to the exact same house, exact same floor plan in Clay County. So I think that you're right. I don't think the cost of milk or, most of the products we buy are different from Platte to Clay. I think it is the housing cost that accounts for that 3% difference.
It's a little surprising St. Charles too,
PowerPoint that's not shown.
being less than here.
I think St. Charles and St. Louis are very comparable in median household income to Platte and household
Even if it's a small
value,
amount.
or home value. Are you controlling?
The sharing wasn't turned on.
Oh,
Can you see it now, Dr. Kingsley?
Yep, I can see it. Yes.
It's the last presentation, so that's good that you finally can see it.
well, thank you, Maggie. That was all, and thank you, Rebecca and Taylor and Michelle Rawlings, who's one of Cindy's staff. Very, very well versed in our whole payroll system, and she was tremendous help as well. After analyzing this year's salary study, and we certainly realized we made great strides last year, or actually this year, as the base pay of most of our positions is now at or above the median. However, in 25, our focus should be on getting the salaries of those specialized public health staff more in line with the median. And by specialized public health staff, we mean those positions that require a degree, but are not necessarily management positions. These are the kind of the boots on the ground staff, the ones that are very public facing, so have a lot of contact with the public and are so important to everything that we do here. The rest of us are really here to support them. So the simplest way to increase pay for those specialized public health staff is to keep them at their current step and range, but to move them from scales 10 and 11 to scales 13 and 14. This will result in the need to move a few middle managers to higher scales as well. So if we were to do that, 16 employees would remain on the scale where they are currently, and 20 employees would move to different scales. I would like to note that the compensation for Andrew, Cindy, Taylor, Dustin, and I, and Dustin and me, would not change under this proposal.
So Dan, I think I saw in the packet that said something to the fact that it would be a change of what, $200,000 increase in our payroll. Does that sound right?
122,000.
122,000 increase.
45, yes.
Yeah, I believe it was about a 6.5% increase.
122, yep, that's what I saw, yep.
So, yeah, the overall increase in the department's gross payroll with this proposal would be 6.51%. So from approximately 1.883 million to 2.006 million. Now, this is before any cost of living increase that I'll mention later. I think I skipped over part of this. I'm sorry.
I skipped. I did it
Oh,
because
did you?
Dr. Kingsley skipped ahead.
Oh.
Hey, at least I did my homework, all right? Give me a break.
Oh, that's good. That's good. But to give you some context when we talk about pay scales, this is what a typical pay scale looks like. So we have 22 of these scales, and some of these scales have subscales. For those positions where having a master's degree benefits the agency. So when a new employee with no experience is hired, they're placed on step 1, range A. Then a new employee with experience may be placed at a higher step in range. For example, or did I say a new employee with experience may be placed at a higher step in range? For example, a new clerk with 3 years of experience, say coming from Clay County Public Health Center, would be placed at step and range 3C. So that would reflect their experience. With each year of service, the employee moves down 1 step. And then if their performance is satisfactory, they move over 1 range. So that's kind of how our pay scales work. Hope that makes sense. And then here are a few of the examples of various position titles and then the corresponding scale associated with those positions. And again, the M scales are those subscales that I referred to earlier that are employees who have a master's degree, in which case they're paid at a rate of 5% higher than those persons in the same position without a master's degree. So I mentioned these figures already. So this slide reflects how the proposal would impact our competitiveness for those specialized public health staff and actually all of our staff. As you can see in this table, it gets our base pay over the median for all positions when compared to our peer agencies. The yellow column shows where Platt is now compared to our peers if you take all of the positions and kind of average them out. And that's where we are now. The green column shows where Platt will be after the proposal is implemented. So we'd be up there below Johnson County, maybe a little bit below St. Charles in some positions, but we'd be, and again, this reflects our cost of living is higher, so our pay should be higher, but we would be up there with kind of those health departments that set the gold standard, certainly in the area, Johnson County being one of them. I think not only do they set the gold standard for pay, but they set the gold standard for performance too. I think it's a very high performing health department. And then the orange column that shows where the, I don't know if I call it orange or not, but shows the current median. So you can compare those amounts to the proposed amounts. So if we're to include a 3% COLA, which the finance committee discussed and I think agreed on that proposal to ask for a 3% COLA for 2025. But when you include that 3% COLA, the new pay ranges will look like this. And
if you add the COLA to it, what is that to our, so the 120,000 goes up to what?
Would add about another 60,000. So it'd be probably about 183,000, maybe 184. For every $1 million of payroll, $30,000.
Okay, can I ask a kind of almost a silly question, but how many of our employees actually live in Platte County? I'm just curious.
I don't know the answer to that. And by the way, we have 39 total. Well, we just hired 2 more. We have 41 total no one retired. We have 40 total employees. Some of those are part-time, half-time, three-quarter time, PRN. That includes every employee we have. But you know roughly how many live in Platte County?
At least half. But
Half of our employees do.
At
Because I
least-
mean, it's those employees where the cost of living makes a difference. Because if everybody's living in other counties, then the cost of living in Platte really doesn't make any difference to them. So it's
Well,
only the employees that live in Platte County where that really applies.
But we're in Black
I'm
County.
gonna make a suggestion. Let's go ahead and let Dan finish. We'll let the finance committee's assessment come through, and then we can kick it out for open discussion.
Right.
For efficiency's sake.
I hear you.
So-
Go for it.
Here is the finance committee's recommendation for the board to consider, and I don't need to read that to you, but if the board has any questions about any individual employees, we probably should reserve that for executive session, executive session, but finance committee, Maggie, all of us, I think, are happy to answer any questions that you might have.
So one thing I do want to point out is the recommendation here doesn't take into account cost of living between the different jurisdictions at all. Maggie kind of said that and then explained kind of the preliminary work, but we didn't look at that. We simply looked at comparison of the positions is
Okay.
what was in front of you.
Okay. The next question I have, when it comes to COLA, what percentage each year for, let's say, the last 5 years have we given a COLA? Like, we do 3% COLAs every year, or what have we been doing for the last 5 years?
So I don't know about 5 years, the last 3 years. In 2023, we did a 5% COLA plus a 1% COLA that started in May, due to moving to this building, which is in Kansas City, with that extra 1% tax. And then the last 2024, we did 3%. And so this would also be 3%.
So if you compare that Social
Go ahead.
Security, if you compare that to the Social Security Administration, I think you have those figures too.
Yeah, so the social security cost of living increase for 2023 was 8.7%. And like I said, we did that 5 plus 1, so I guess like 5.5 technically. And then 2024, it was 3.2, and we did a 3% increase. And then for 2025, it's 2.5.
Yeah, so Social Security's cost of living, I think you understood that for 2025 is 2.5%.
So Social Security's increased their cost of living every year too? For the last 5 years?
I think every year they assess that.
All right. Does that conclude the presentations?
It does.
If nobody objects, I'll just jump in real quick with a couple questions, comments. Are we having difficulty in a business? You can say how you compare to every other business, like all these other counties. At the end of the day, I think there's some critical items that we need to look at, that affect our ability. It's supply and demand. In other words, if we're paying good enough, but are we fully staffed? Are we having too high a turnover? Any business is going to look at there's a value to not having high turnover. You gain value from experience. Experience equals more efficiency, etc. So as we move forward, I want to make sure that we're going to monitor items like our attrition rate or turnover rate, our ability to fully staff. And because to me, those are the most important numbers, that we are having lower turnover, ability to staff fully, and that if we make these changes, are these changes meeting our goals? So I guess I would open it up to the rest of the board. Are those reasonable goals for salaries at this point? Not just to say we're above median, but we're meeting the needs of this business and with those parameters. So I'll just open up for any other comments. Okay, anybody else have anything they want to chime in about? Because I think that
Yeah,
we need to be fully staffed. We need to decrease turnover. I think also there's the perception issue that if we have folks who are concerned, thinking they may or may not be getting fair compensation if we're at or above the median, we take that off the table. Employee satisfaction hopefully will go up, and that will be less of a problem. But it also shows that administration and this board is sensitive to the perceptions and needs through these surveys. And it's going to be hard for me to ignore it. And I will just say right now, I'm enthusiastically in support of having a methodology upon which to justify keeping us fully staffed, decreasing turnover, improving employee satisfaction and perception, but also making sure that as we move forward, that perhaps we can look at putting together some guidelines or policies or bylaws about looking at COLAs, how often, I think we ought to, as a board, look at how often pay needs to be addressed, try to put some structure in place so this will take care of itself moving forward, and that we're not always coming back every year and
having a salary study.
right.
Yeah,
Right.
I also think that only looking back a year at a time is kind of, uh, is insufficient, um, for just overall, like, knowing what we've been doing over a period of time. I think looking back at, um, 1 year and saying, well, there was a 5% increase and then a 1% increase when we moved. Um, and as far as social security is like 8% cost of living, like, yeah, I mean, I think everybody's cost of living's gone up, but I don't know of any business or company that I know personal nurses and stuff like that that have had raises and things be over like 3 to 3.5%, though their cost of living has matched everyone else's in the county, the state, the nations, those kind of things. Where I know just working in one of the bigger, you know, companies in the Kansas City area, where I mean they weren't doing a 5-6% raise for anybody. So that's actually I was surprised to hear that number come through.
Perhaps it's something that finance committee could take up to come with a recommendation of how to put some procedures in place to address this moving forward. It's a thought.
Well, I think we based it on the salary study. We looked at that, but to look at each position and each,
No, I'm suggesting that we try to come up with something moving forward so we don't revisit this annually.
And we can do that.
yeah,
I'm sorry, Susan, last year, the board actually asked us to revisit it annually,
Yeah.
but we
Okay.
can certainly take it back to finance committee and put together an approach. And we do have all the numbers for all the COLAs for, the past 10 years, and we
Sure.
can but we can certainly come back with a recommendation.
well, and I think this was important to do it for this year.
Right.
Because we moved to this building, we're looking at getting accredited,
Mhm.
we're looking at different positions and some employees having 3 or 4 jobs and figuring out which needs to be lined up to individualize that, and maybe that needs to make a full-time position, which we've kind of done, move people out of positions doing 2 or 3 jobs to one. So this is
And
kind
we're
of just,
very happy
it's,
about
yeah, and this is just kind of coordinating all of that to meet our needs of this building and to move forward.
Yeah, I think next year,
But-
if we were to do this again, we certainly don't expect to come back with a whole nother group of positions that need to be
Correct,
increased.
no.
I think we started the
No.
job and did really well
Correct.
in 24, but we just kind of finished the job.
Jeff, you had a comment?
I was gonna say, it's kind of what I was talking about earlier. I think to me, as long as we're equivalent to Clay County, and if our cost of living really is that a titch higher than them, then maybe our salaries are, once again, a titch higher than Clay's. But to me, I think that's the equivalence. I mean, if people really want to move to the other side of the state because they can make an extra $1,000 a year, I mean, it's going to happen regardless of what we do. But to
That's
me, I'd rather be competitive
50
with
cent an
Clay.
hour change.
Yeah.
50 cents an hour
Yeah.
is about that. I'll just share, Dr. Kingsley knows this quite well. The Board for the Developmentally Disabled in Platte County was struggling to meet our fully staffed 110 employees. And we took a very drastic approach and increased the pay, but also the benefits. And we saw a direct improvement in retention, decrease in turnover, and ability to fill positions, and it's improving. So as we move forward, I think that's, any business, and I think we have to look at this with at least a business lens occasionally, is the turnover, the retention is important, and the ability to fill positions in a reasonable time frame. Because if you can't, it's the supply demand model. I don't care where we're at. We have to do that as a business. Our widget cost is X, but it doesn't. We have to keep it staffed. So with those, it's good to have these comparisons and look at that. But as we move forward, I think we should try to eventually get some guidelines. For example, if we decide that annually we want to look at the COLA, which takes into account inflation, other items and costs of living, the cost of fuel or whatever. And I think maybe Finance Committee can bring a recommendation as that gets fleshed out. But
I wouldn't expect to have this conversation next year regarding all of these changes and
Yeah, just
that-
COLA.
that's all.
Yeah.
Nothing further, because this should be a readjustment in all of that,
Yeah.
and we should be done.
I would entertain if there's anybody who wants to make a motion on this presentation or item. Are we at that point? Zach, you got anything else you want to contribute?
No, I fully agree. I think this is something we look at as a one-time get us back to competitive levels, and from there, just looking at it as inflation, cost of living increases as they go up, then we will help our staff maintain those livable wages.
Susan, Kim, any other comments? Are we in a situation here where this is ripe for an action item? Any other board members feel we're there?
I'd say
I'm
we
getting
just vote on it. Let's do it.
All right. I would entertain a motion. All right, I'll make a motion. I would move that the board accepts the recommendations of the Finance Committee on salary adjustment.
I'll second it.
Keeps it simple. Any further discussion? Hearing none, I'll move for a roll call vote. I'll go first to Zach.
Yes.
Kingsley.
Yeah.
Kim.
Yes.
Susan.
Yes.
Microsoft is yes. It's unanimous pass.
So one thing I will say, and it's kind of to Kim's point, I think one thing we will want to look at is maybe, not bringing back this whole salary study every year. I think that makes sense, but maybe we'll talk about it in Finance Committee, maybe every 3 or 5 years, just touching base to make sure we haven't migrated some weird way. I think that might make sense. Does that make sense to you, Kim?
I think
didn't want you to be surprised in 3 years if we say.
I think 3 years is reasonable, but yearly is a little
Yeah, I agree.
overkill.
Yes, you don't want to hear it.
I know that's not done anywhere else I've ever worked. We don't have salary studies every year.
Right.
I'd love it if the Finance Committee could bring a suggestion for how to, as I said, codify this as a protocol or whatever moving forward to decrease the workload. And we can monitor the progress of it. So if we start seeing 5 years from now, our vacancy rate is increasing, our turnover rate is increasing, and do we believe it's due just to salary or is it other circumstances?
And when someone leaves their position here, is there an exit interview where you discuss, hey, is that documented somewhere where we can say this person left, they went to this position because of XYZ type? That's something that other places.
Have formal exit.
No, okay.
Might be something that,
That's something that
kick
I've
around.
done everywhere I've ever worked. They ask those questions because they want that.
Well, we get feedback. It's just not every employee it's not done through HR necessarily directly with us in a formal setting.
Sure.
But the discussion does take place.
Yeah. Okay.
So we have tabled.
Indirectly, it's done.
Right.
If there's no more discussion on this, I will move financial advising. Oh,
Sure.
yes, go ahead.
Because does this include the COLA or not include the COLA?
It was the whole package.
The whole
Yes.
package. Okay,
Yes.
that's what I just wanted to clarify.
It was the 6.51% plus the COLA.
Okay.
Which only makes sense.
Right.
In
And
other
the
words, we're making the
6.51
adjustment
for
to bring
those
it up, and then we're adjusting it
specific
for the year.
positions.
Yeah, it was
That
to
wasn't
move
for
the,
everybody.
it was to move the scales and then
Yeah,
for the
great,
three.
yes.
I think we have made a motion to move the RFP for investment services to the finance committee already. So
Yeah.
we're at maternal child health services amendment 5.
And Dr. Chape, if you don't mind, before we move on to that, Cindy Cogan had texted me and said we actually still need to accept the fee resolution. I
Okay.
guess we did not do that, so we do need to
Then
have
I
a motion
would,
to accept the fee
I
resolution.
move that we accept the fee resolutions as presented.
I'll second that.
all right, let's just go to a vote unless I hear any objections. Zach,
Yes.
Kingsley,
Yes.
Kim,
Yes.
Susan,
Yes.
Michael says yes. Pass unanimously. Thank you, Cindy.
Mhm.
Okay to move on?
Yes.
All right, so we're gonna go to the maternal child health services amendment number 5.
This is a contract we've had with the Department of Health and Senior Services for years. The contract amount changed by a few dollars for fiscal year 25, but it's $25,251.17, and the contract period is October 1 through September 30. These contract funds are used to support a lot of activities that our health educators do. And then in the memo, you can see the recommendation and suggested motion for the Board of Trustees.
Anybody have any questions or,
Andrew, can you pop that up on the screen? I just see the faces again of people.
yeah, he probably wants you to select the amendment suggestion.
We're just about there.
Should have it now.
All right, there you go. Okay.
Open for anybody to suggest a action item here.
It's on there.
At the bottom, if somebody wants to read that.
I move that we authorize the director to sign amendment number 5 to the maternal child health services contract between DHSS and Platte County Health Department for the contract period of October 1st, 2024 through September 30th, 2025.
I second that.
All right, not hearing any further discussion, move for a roll call vote. Zach,
Yes.
Yes.
Kim,
Yes.
Susan,
Yes.
Michael's yes. Passes. So we have the next item on the agenda is personnel action. Anybody,
Yeah, we just need
Okay.
to vote on it
what is it?
to
Oh.
move to accept these personnel actions.
Okay. Everybody had a chance to review these. Anybody have any questions? All right, hearing none, I'll move to accept the personnel actions. Is there a second?
I'll second.
All right, roll call vote. Zach,
Yes.
Yes.
Kim,
Yes.
Susan,
Yes.
Michael's yes. Okay, before we move on, I know that Dan had listed in his report about a meeting we had with President of the Senate, Cindy O'Laughlin. I'd like to, for full transparency, explain a little bit about that. One of our commissioners had interacted with this person, and the senator was very interested in seeing what are keys to success for her. We had a brief meeting, and somehow were cajoled into doing a site visit to her county with her there, because she is very interested in the idea that we can put together resources from things like Mosifi, Nalbo, maybe a Missouri group for Board of Health trustees to organize, but to try to also work with DHS and provide support and resources to other counties that aren't as beneficial as ours. And I think I got our, in full transparency, I think that when we accepted this, this is going to take resources to go do this. And I'd like the board members to have an opportunity to evaluate this and this not be a pet project of one of the board members who's encumbering the time and energy of employees here. But we've been invited to go to another county to assess and see if what we're doing here can assist them or see what their needs are. And in working with Tiffany at DHS and the president of the Senate, I'd like to see if anybody thinks this is a waste of time or if it's, we can help assess another county, see if something that we can get behind, something to help with a Missouri Association of Local Boards of Health. We can coordinate with DHS, Mosifi on this. I know that at least I've spoken with Andrew and Dan about this independently. They're in support of it, but I think the board members deserve an opportunity to be heard on this.
I
What would you
support it,
think?
and I was gonna say, if, as long as it coordinates with my work schedules and stuff, I'm more than happy to go on the road with you guys.
Yes, how many of us could really
What were,
participate in
what are the goal? I mean, the goals are to improve their care in their county or their cohesiveness of their board, or what is the goal?
The goal is to assess to see what we can offer them.
Okay,
This is sort of a trial run. For example, we'll look at how they're funded, how their board members are selected, if they are obtaining grants, if they're not, how can they get help with getting grant funding? Do they have a tax levy? If they don't, how, what the process they go through to get that, but to improve the funding, staffing, and eventually, hopefully, to work with DHSS to try to get them also on the path to accreditation, which to me is a glorified continuous quality improvement.
Okay.
We had kicked around the idea of forming a Malbo. Tiffany Bear from DHS has encouraged us. We went to the Malbo conference, and I think that Dan and Andrew and I kicked around some ideas of what can we do, and the senator was very open to some ideas, but said, come take a look at my county, let's see how this plays out, and then you can make some recommendations. But apparently she may be in a position to help spearhead lifting up the rest of the boards of health in the more rural counties. And for example, have a central repository for bylaws. How did you get grants? Maybe a big brother, big sister, little sister organization to meet and provide resources to counties that don't have this. So this is sort of a trial run. And Dan, Andrew, please chime in. That's kind of my perception, but I don't want this to be my pet project.
So I'm sorry.
Okay.
So, Audrey Go, who's one of the directors in the area, so it's actually, I believe, quite a few of the health departments that she, in that area of Northwest Missouri, that she invited to next week's meeting. And it was basically, I'll just read you what the invite says. Recently, I met with Platte County Health Department officials, including a board member. I was invited by a friend of mine who lives in Platte County. Platte County is more populated than most of our counties, but I was impressed by the operation of the department and some of the novel ideas they've come up with. I invited them to visit and share their ideas. Those ideas included possible grant funding to help pay for some of the health department initiatives and also on the administration of the department. They have graciously agreed to come, blah, blah, blah. And it's set for next Wednesday at 11 o'clock till 1. So I think at least this first thing is she's trying to have a convening of all the local health agencies, boards and staff, just to have kind of an open forum is what I gather. Is that?
Yeah.
And just to chat about some of the things we're doing.
Is there any way, Andrew, is there any way that we can get the Secretary of Health and Senior Services invited to this meeting, whether in person or by Zoom? And the reason I say that is Susan and I, when we were in Columbia, she was right there listening to what we were talking about, what we were discussing in that open forum. And she was actually there to see how some of the health departments in the different counties are really struggling. And so I think she saw firsthand kind of what was going on, and she might be very helpful to the cause as well. So I don't know how that works. I don't know if the speaker of the Senate and the secretary are close or speaking terms, or I don't know all the politics behind it. But that what's her name? Patty? Is that the secretary? Paula. Yeah. So I think it would be very beneficial, I think, if she was involved and really show that the executive branch as well as the congressional branches of Missouri are interested and involved, and that we could hopefully move forward and then start getting more buy-in from other counties, other health departments, other directors to really get the ball rolling. I could be wrong. I've been wrong before, but I think that would be a very good start if it's possible.
I'll ask her. I mean, I think the only real issue, Dr. Kingsley, is just the time frame. That's not very much
Short notice, and I think none of us really know what we're doing, so we're gonna go figure it out, brainstorm, and then come up with a set of recommendations to see if something like this can work on a state level. So my sense, and gentlemen, please chime in. My sense was Senator O'Loughlin was trying to be there herself and assess if something like this will work, so that if she's ever in a position to spearhead and support legislation and or funding for something like this, that she'll have a firsthand view of her county getting benefits from an interdiction or action like this. Is that close to fair?
Well said. Yes,
Okay. So at this point, it's more of a, let's go feel out the situation, see what their needs are, see if it's something we are able to easily do, and then come back and make recommendations for suggestions to try to roll something out statewide.
Yeah,
And that's
I think kind of what you're talking about too is to be a mentor, to be a facilitator, all those different things. That's kind of what I think our role should be going forward, if we can. Maybe everything we do doesn't make a difference, but if we could at least try to help some different counties, to me, it seems like it's a win-win-win proposition.
and it's also maybe an avenue by which to have somebody at the state who can get their finger on all of the data for how much per capita funding is done through tax levies and state funding, to see if there's comparisons otherwise. Because if there needs to be more funding and there's statistically accurate, without selection bias data,
right,
that is something they can take, because you don't want to have somebody take a bad number and then have it torn up because they were lazy and didn't really do the analysis on it. So, all right.
The other thing too, though, is maybe there is enough funding, but maybe nobody knows how to get access to the funding. They don't know how to do the grant application, kind of what you were saying earlier. Maybe they don't have the background ability to apply for these grants that are available that they could take advantage of. So there's that whole aspect as well.
I just wanted to bring it up to the rest of the board for transparency. Because I've been encouraged that I might be somebody who can drive to get a Malibu going, not necessarily affiliated with the national, but for a Missouri board to support board members who may or may not have experience, so that some places that don't have as many healthcare experienced individuals on their board, we can give them recommendations that you just have to be a reasonable person who's willing to get the information and perhaps bring in your local healthcare folks as a consulting or subcommittee or an ad hoc committee, but outside the box ideas like that. So, all right, we're pushing the meeting. Is there anything we need to go into executive session for?
Not tonight.
I would, if there's no objections.
Did we approve the personnel action?
We did.
Okay, just making sure.
We did. Thank you. Thank you.
And I think there's some checks missing.
I didn't keep them.
So.
Right.
That are
Uh,
here.
It just
So I
doesn't seem like
typed whatever.
as many.
Well, no, and there's
Are
That's the
they,
list.
some on
are they
here.
under $1,000?
Yeah.
Because I would have signed.
They-
Oh, okay.
they're Andrews.
That may be.
Okay, oh, okay, okay.
All right. Very good.
That's it. Thank you.
I guess everybody knows that, we're going to the Bond Saint. There's a benefit tonight. Northland Healthcare Access starts at 5:30, Argosy Casino Hotel and Spa.
And all three of you are attending.
We are.
Yes.
I am.
Mhm.
I gotta go home and get my name badge. I gotta hurry. I forgot.
I don't have
All
my
right,
name
have
back.
fun, guys. Hopefully it's a good
Uh,
time for everybody. I enjoyed it when I went, so.
All right.
All right, I
Make-
make a motion to end the meeting so you guys can get on the road.
Right.
Second.
Second.
All right. Zach? Vote?
Yes.
Jeff?
Yes.
Yes.
Kim?
Yes.
Susan?
Yes.
Michael's yes, and we are adjourned.
Okay, thank you, everybody. See ya.
Everyone.
Evaluating?
Yeah.
And then if there's a recommendation for a broad sweeping assessment